Welcome back everyone. We hope you enjoyed your lunch break and had the chance to recharge yourself. Now without any further delay, let's welcome our session chair. For this, I would like to introduce Dr. Shehzad Irfan. He is an assistant professor and researcher in the Department of Physiology of the Government College University Faisalabad. He obtained his PhD in endocrinology and physiology of reproduction from University of Münster, Germany. His focus has been on the specific impact of different non-herbal and phytochemicals on the regenerative capacity of pancreatic beta cells, insulin synthesis and secretion, and transcriptional modulation of hepatic glycolytic, lipolytic and lipogenic genes through different transcription factors in type 1 and type 2 rodent and primate models. Ladies and gentlemen, let's give a round of applause to Dr. Shehzad Irfan. Please come on the stage and start your session. Dr. Shehzad Irfan.
I would like to introduce our next session chair, Associate Professor Dr. Nazia Rahim. She is currently working as an Associate Professor at the Department of Pharmacy Practice, Dow College of Pharmacy, Dow University of Health Sciences, Karachi. She has also been awarded a PhD in Pharmaceutics from Karachi University. Ladies and gentlemen, a big round of applause for Dr. Nazia Rahim. Dr. Nazia Rahim to please come on the stage and kick off today's session.
Assalamu alaikum everyone. Now we'll proceed with the second session, session 2, Medical and Health Sciences. Our first presenter is Dr. Naila Jabin, Associate Professor from International Islamic University, Islamabad. And her topic is Green Synthesized Nanoparticles as the Novel Approach for Drug Delivery System. I welcome Dr. Naila Jabin. Dr. Naila Jabin. This is last call, Dr. Naila Jabin, Associate Professor, International Islamic University, Islamabad. Can I proceed? She is not here, so proceed to next presenter, Dr. Kainat Asmat, Assistant Professor, Shifa Tamir Millat University, Islamabad, Pakistan. The title of her presentation is Patient-Centered Self-Management Intervention, a multi-center randomized controlled trial in Pakistan. Please welcome Dr. Kainat Asmat.
Bismillahirrahmanirrahim. Good afternoon, everyone. Thank you so much, Worthy Chair, for my introduction. I just wanted to update on my position. I am now Associate Professor and Assistant Dean, Graduate Studies and Research at Shifa Tamir Millat University, Islamabad. The topic which I am going to present today is about patient-centered self-management intervention for type 2 diabetes mellitus. It is a multi-center randomized control trial in Pakistan. As we all know, that diabetes mellitus is one of the most prevalent public health concerns around the world, particularly in low and middle income countries, and the one in which we are living. According to the International Diabetes Federation, Pakistan is on the top with the highest national prevalence of type 2 diabetes particularly. And currently, 26.7% adults are living with diabetes mellitus, and around 11.4% are with the impaired glucose tolerance. That means that they are at risk of developing type 2 diabetes in their future. And over a quarter are still undiagnosed, which is the hard fact that the type 2 diabetes mellitus goes undetected and the patient presents with the life-threatening complications such as stroke, heart attack, kidney failure, blindness, and lower leg amputation. In terms of mortality, in the single year 2021, Pakistan faced around 4 lakh deaths, which is the highest number of deaths in the whole region. And in terms of its economic implications, diabetes and its associated complications led to the cost of $332 per person, which is a huge cost as a mere Pakistani who is earning less than $3 a day. So with this, we realized the huge impact which type 2 diabetes is creating in our country. And if we talk about the predictors or antecedents of type 2 diabetes, we see that the key contributors of its prevalence are the genetic factors, family history, unhealthy dietary habits, lack of physical activity, and obesity. So given the huge health and economic impact which type 2 diabetes is creating, and the fact that the major contributors are the modifiable risk factors, so it is high time to move our immediate attention to managing these modifiable risk factors. If we talk about the type 2 diabetes management worldwide, we see that international practice guidelines, including World Health Organization, International Diabetes Federation, American Diabetes Association, and European Association of Study on Diabetes, all have the consensus that self-management through lifestyle modification is the cornerstone that we have to manage type 2 diabetes. But when we see in Pakistan, there is no working policy or action plan to address type 2 diabetes, and there is a lack of implementation on managing the leading modifiable risk factors, which I have talked about earlier. And if we look into the care provided to the patients with type 2 diabetes, is very much fragmented, which is overlooking the personal, behavioral, and social factors which are associated with this disease. And from here, we have realized that there is an urgent need to shift the change in the paradigm of care of type 2 diabetes. We need a shift from traditional disease-oriented model to the patient-centered care model, where we can take care of patients' personal, behavioral, and social considerations of the disease. So with this, we have started our study. The phase 1 was the systematic review and meta-analysis. We have conducted a systematic review to determine the effectiveness of patient-centered care versus usual care in type 2 diabetes. The paper has been published in International Diabetes Journal with impact factor 5+. And our meta-analysis of randomized controlled trial come up with the conclusion that patient-centered care is very much effective as compared to usual care with the effect size of 0.5. And this systematic review has informed us about the key features which our patient-centered intervention should entail to bring up the optimum glycemic control. So the meta-analysis phase informed us to design our patient-centered self-management intervention. And the very meta-analysis showed that all the interventions which were based on some kind of theory, which have a theoretical grounding in them, were more effective as compared to the other interventions. So we sought out the search for the theory, and we have selected the Bandura's self-care theory, which is, the major construct of this theory is the self-efficacy. That self-efficacy is basically the motivation or determination of the patient. If this is enhanced, then that can bring up the change in the self-care behavior of the patient that can lead that patient to get the optimum glycemic control. So the self-care theory by Albert Bandura have made the theoretical pinning of our patient-centered intervention. And then we have designed the three components of our intervention. The first component was a patient-centered individualized education. And then the second component was the counseling, in which the researcher went up with the individual counseling sessions with the patient. And then the third component was behavioral training, which was again based on the Bandura's self-efficacy theory. And the researcher utilized a 6-step behavior modification process to bring up the behavior in patients' self-care behaviors, particularly in terms of diet control, physical activity, food care, and medication adherence. The whole protocol of this intervention has been already published in an international diabetes journal. Then the design development phase has ended up, and then the testing phase started, in which we have tested the efficacy of our patient-centered self-management intervention through a randomized control trial. It was a large-scale, multi-center randomized control trial, which was conducted in outdoor patient departments of 4 public sector hospitals in Faisalabad. We have recruited the patient from the OPDs of the hospitals, and after signing in the informed consent, we have taken the baseline measurements. At the time of baseline measurements, there were 3 outcome variables which were measured. Number 1, HbA1c, which was taken through a venous sample of the patient. And then the self-efficacy, which was through an interviewer-administered questionnaire. And then the self-care behaviors, the particular behaviors about diet control, physical activity, medication adherence, and food care. And it was again assessed through an interviewer-administered questionnaire. So after getting the baseline, the patients were randomized through a block randomization model to the 2 groups, the control group and the intervention group. The control group have received the usual care which was in practice in the OPDs of that hospital. And then the intervention group, particularly in addition to the used care, received patient-centered self-management intervention throughout the 8 weeks, like the whole intervention gone through the 2 months period. And right after the end of intervention, there was a phase 2 of measurements, which is labeled here as T1. So at the end of the intervention, again HbA1c was taken, and the self-efficacy and the self-care behaviors. And then the patients were followed up for 3 months period, and then there was the last phase of measurements, which was the T2 phase, where we have measured again the 3 outcome variables. And after that, there was an analysis phase where we have compared the glycemic control, like HbA1c, self-efficacy, and self-care behaviors between control group and the intervention group. So this is the whole trial profile. We have screened 750 patients in total, and out of them, a portion of patients have already refused to get entered into the study, and the others were excluded based on the inclusion and exclusion criteria. Finally, we have included 612 patients according to the power analysis and effect size of the study. So 612 patients were distributed to the control group and intervention group. 310 patients were included in the control group and 302 in the intervention group. At the end of the intervention, like at the time of the last follow-up, 583 patients were there in the study, and the loss to follow-up was 4.74%. Moving to the results, in terms of socio-demographic characteristics, you can see here in the table the demographic characteristics of the participants in control group and in intervention group. What I need to emphasize here is we can see that majority of the sample have low level of education, and then one strong point in our sample was that almost all of the participants were living with the family. It means that family support was evident in terms of patient-centered care. Talking with regards to the clinical characteristics, we see that duration of the disease, the mean duration was above 5 years, which is around 6 years. And then, as you all can see, that cardiovascular risk factors were very much prevalent in the whole sample. It means that this is another area of research that we can see the efficacy of this very same intervention to see that whether it helps to reduce the morbidity or mortality related with these associated risk factors. Intention to treat analysis was conducted on HbA1c, and we have used the ACSE software for data analysis, and we have tested through an independent t-test, and as you can see that at T0 both groups are similar because the p-value was not significant, and at the T1 also both groups are similar, p-value is not significant. But here at T0, at the conclusion of the study, there is a difference between control group and intervention group. It means that the intervention group has shown reduction in HbA1c, and that reduction was very much significant statistically. Now about the second outcome variable, which was self-efficacy. Intention to treat analysis shows here that at T0, both groups are very much similar. At T1, there is a statistical significant difference between control group and intervention group. And at T2 also, as we see that self-efficacy is even further improved, and there is a significant improvement in self-efficacy in intervention group. Talking about the third outcome variable, intention to treat analysis shows that T0, both groups are same, and at T1 there is a significant difference, and also at T2 there is further a significant difference between two groups. So the results show that intervention group has improved self-efficacy as compared to the control group. So we concluded that this multi-center trial demonstrated that despite the low level of education among the study participants, a theory-driven, culturally congruent, patient-centered self-management intervention boosted their self-efficacy and in turn improved their compliance with self-care behaviors, which ultimately resulted in significant improvement in HbA1c at 3 months. Thank you so much. I'm open to questions.
Thank you, Dr. Kainat. Any questions? Yeah, please.
Dr. Kainat for a very wonderful presentation. Well, being a social scientist, I try to capture most of the constructs and how you go about the whole randomized control trial in Pakistan. Well, I have a query related to the what happened to the control group. Once you are done with the research and you got the statistics and data, because they are equally vulnerable, just like an experimental group, but the experimental group has been quite advantageous because they received a patient-centered management intervention treatment, but the control group does not. So far, so good. But what happened next? Ethically, what was done with the control group?
Thank you so much, ma'am, for bringing up this question. And as this whole study belongs to my doctoral dissertation, and at the time of getting ethical approval, this was the major question which I was asked about, and along with my supervisory committee. And what we have responded to this question was that, like the reviewer at that time posed a question that this is made very much evident that behavioral intervention, if it is in patients, it is patient-centered, like it is at the level of the individual, then we are very sure that it will be very effective and it will come up with the improvement in outcomes. Then why you are keeping the control group deprived of that intervention, and you are not teaching them or counseling them or training them behaviorally at their level? So we have responded that there are two reasons. One is that although there is an evidence on international level, but we want to see the efficacy of this intervention in our context, particularly when we are grounded in very much social structure and different cultures. So we, in order to see the efficacy, the design of randomized control trial by its signatory element says that there must be a control group. And we need to test this design, or we can test this intervention when we keep an intervention group. But yes, we have a plan for the control group also. We have demanded the funding for the study for 612 participants, which will be included in our study, including the control group. And right after my intervention ended, my study ended, we straight away went back to the control group, and this whole intervention was implemented on that group also. And we are in the period of analyzing those results.
That's wonderfully great. That is the reason predominantly we usually don't label them as control group. We try to label them as intervention awaiting control group. That's a much better term. It automatically dissolves all the queries. It means that yes, they will be receiving the intervention, but sometime later, once the efficacy is being established.
Thank you so much for this term. I have noted it down. Thank you.
Any questions? Can I ask something? First question is, what randomization technique you used during your research? And because we have different randomization techniques and methodology. And secondly, you said that they were also suffering from other diseases like hypertension, like diabetes is a disease of an old age. So then how you consider or resolve the issues with the confounding variables? Because we cannot say that these groups are purely diabetic patients. So the confounding variables, how you cater these issues? Thank you.
Thank you so much, ma'am. In answer to your question number one, which was about the type of randomization which I have used in this study, so we have used stratified block randomization, because my randomized control trial was consisted of 4 different settings, like hospital A, B, C, and D. So the randomization plan was to stratify the scheme for each individual hospital separately. So it was a stratified randomization, and it was a block randomization. So the statistician was the main planner of the randomization, who have developed the blocks of 4, 6 to develop the scheme of randomization. Thank you so much. And in response to your second question, like how we made sure that this is a patient with diabetes and not a patient of hypertension or like cholesterol or like myocardial infarction was the history. So as the patients, we have first started the recruitment from getting the records from the OPD register of the patients. So in OPD register, in public sector hospitals, patient is having a regular follow-up or is visiting regularly. So in the register, when the diagnosis of the patient was the diabetes, we have taken only that patient, like the patient who is coming with the disease diabetes and who is getting care of that particular disease. So that patient we have included. And we have set an inclusion and exclusion criteria also, that those patients whose primary diagnosis is other than diabetes, those will be excluded, and who are critical or with limiting medical conditions like multi-morbid conditions, they will be excluded. So only those patients where the primary diagnosis was diabetes and the hypertension and cholesterolemia is coming later after diabetes, they will be included, and they were included. Thank you.
Just asking any other question. Please, go ahead.
Thank you so much, Kaina. Nice presentation. I have, first of all, I have one further question. Have you collected this data from different genders, like males and females? Definitely, yes, because this data is not complete without such type of male and female. And second question is, what were your results as far as gender is concerned? Whether patient-centered self-management interventions are more powerful to control diabetes in male or in females?
Thank you so much for bringing up this concern, and my study findings have showed out the differences, the gender-based differences. And we are in the phase of writing another paper where we will report the gender-based differences or gender-based responses around patient-centered self-management intervention. And yes, in my research, females and males, both genders were included. And the good thing of the randomization success was that we have come up with an equivalent proportion of men and women in our study. So we have a large number of men and women representation in our sample, and we are in the phase of writing responses to them. As far as my observation is concerned, because right now I don't have statistical results with me, but being a principal investigator, my observation was that the response to patient-centered self-management was very much clear and representing the men side. And it was not that much effective in women as compared to men. Here we can apply the test, and we come up with different reasons. As being the female, being the in charge of their home, they might have certain social structural constraints or cultural constraints, as we see that men can go out for physical activity, for any other concerns, but women are bound to their homes. So there were differences, and in terms of comparison, men's response were more improved, HbA1c, self-efficacy and self-care behaviors as compared to women.
Thank you.
Thank you so much.
Dr. Kaina.
Thank you so much, everybody.
Thank you.
So our next presentation, yes, please, few claps for ma'am. So our next presentation is it's titled as the toxic effects of azithromycin and erythromycin on liver enzymes and other biochemical parameters of male rabbits. And this presentation will be presented by Dr. Mehreen Riaz from University of Suwat. So Dr. Mehreen Riaz from University of Suwat, if she is here. Okay. So apparently it seems that Dr. Mehreen is not here. So the next on the slot is the presentation is possible potential of moringa stinopetala kafut for irritable bowel syndrome therapy. And this topic will be presented by Dr. Amber from Aga Khan University, Karachi. Okay, so she's also not apparently here. So the next would be the socio-cultural barriers and health-seeking behavior among female patients of tuberculosis in southern Punjab, and this will be presented by Mr. Muhammad Anwar from Allama Iqbal Medical College, Lahore. Muhammad Anwar. Okay, so the next one and the last one. The DNA mapping management in blood group with fur transforming model. This will be presented by Dr. Naila Rosi from Sindh Madrasatul Islam, University, Karachi, Pakistan. I think she's
Assalamu alaikum, everyone. The ES 2024 conference is very well, mashallah, because all of the event is timely managed. And the G Nationally and all the organizers, which I don't know the name exactly, but Dr. Rubina is here, and Dr. Imran and others, and in our panel members. So first of all, this is basically 4 researchers here. This paper belongs to my student Khatija Ayub. She is a PhD student from Sindh Masjid Islam University, and Sayyid Maqsoozia, Dr. Maqsoozia, Vice Chancellor, Pro Vice Chancellor, Shabji Latif University, Dr. Nasiruddin Khan, my supervisor, and also ex-Vice Chancellor of Karachi University, and me, Dr. Naila. So, DNA mapping management in blood group by using the Fourier transformation model. So, Fourier transformation model is basically just like we are taking this mathematics in biology for the signal processing. The heartbeats rates and the heartbeat graphic and the actual ECG is done by the MATLAB software and by using the Fourier transformation model equation. So we all know about the human monitoring blood group like ATCG. So and here all of students and everyone knows their blood group. So I discuss here only AB plus, O plus, B plus and A plus. Almost ABO blood group is very effective and very positive working in humans. So we just belong this paper about the antihypertensive agents which can be controversial, and we can resolve it by using the DNA matrix and by using its average value or critical value. So this can be done by the MATLAB software as well. So physical distribution in messenger RNA started sequence, broader conception supply chain management in PCR. Right now we all know about the previous years, जो कुछ हुआ last years में तो PCR test and all other injections and diagnose में सारे diseases, तो उसके through हमने जो क्या किया कुछ भी studies की DNA geometry के ऊपर and build a software which names already used is MATLAB, and the companies normally sees the challenges of these sequencing, which will produce by CTA, GC, ATC, GAT and so on, because this is sequence infinite and continuously going on and on and on. So participating in that way, that if a person has a positive attitude or getting a positive message towards the source and a message, then the mother wavelet and the normalization parameter are selected based on the characteristic in optical event as well. Likewise, this event, I got message, then I do the action and take the manage all what I have to do, where I have to go, and where I have to select the others programming. After choosing the message in the DNA, next task is the deliver to the desired number and type of the explorer. So here this research is basically, as I repeat again, कि डॉक्टर में हमारी जो स्टूडेंट है मिस खतीजा जुनैद, so she is on the way, but right now the situation, so she could not hear. So it is difficult to distinguish DNA properties, but professionally can evaluate the patient's CBC's record for 24 months, and in DNA matrix we can choose the functional matrix, balance matrix and the project matrix. In matrices, first we all know CTGAT we use in 10 and 01 condition in computer, or you can say DNA computer or classic computer. So in DNA mapping we will take the Fourier transformation of AN and BN. So BN take here for stand for the 4 blood group, which I discussed earlier slide. So computer simulator verify the concept, behavior, and the proposed algorithm and apply to the real PCR, like all the algorithm from programming, fundamental algorithm, and other computer-based algorithm we take here. We can see C plus Java as well. So in real PCR, which represent induced DNA verified displacement finger patterns, like we all are doing the biometric thumb in our offices. So all the sequencing are generating and computer take this. Likewise, our barcode system in our NIC or other purchasing item which I take from shopping mall, or the sequencing other generate from, you can say, likewise, air ticketing, because they are 2 times verified by the your NIC as well, or your passport sequencing, as well as your mobile app. So each person which life process defined in biomedical and techno-scientific term as a quantifiable and controllable, and underlying a medical control for this historic in composing. So this belongs to everyone, like not from for the scientists, each and every person, which are direct belong to the human, not necessarily literate or illiterate. So for this research, which is already applicable in mobile app, we have select here 157 student class of undergraduate level for my course, which I taught probability and statistics. So in clinical laboratory tests, use equipment, measure the CPM, psychological reaction, heartbeat, blood pressure, and RNA. So the t-test method of statistical done by Dr. Maksuzia to evaluate the type of the message, and we have assumed that machine use depends on the time and independent of the number of workers. So likewise here, all in this event, like many workers are included, like security and staff and other persons. So for example, the Indian integer programming basically belongs to each and every entity, and formulate to solve the problem where the completion time will become a function. Here we take the integer programming. We take linear equation, or is called the straight line equation, and it can be directly mapping through y is equal to ai plus bjx. Here in typing way I have to write down mu is equal to ck basically, and c1 is your 1001 corresponding matrix of CTAGC, 4 base pair, so we get 20 amino acids. So perhaps the most common error made when monitoring data is gather information that is clearly related to the project performance. With genetic algorithm, we know that the type of the data, and we want to collect every time we're collecting the data, and the construction of monitoring system, it should be precisely what pieces of information we get. Like here, all the session in the room 1 and room 4 I attend, so I get the information about the necessary data which I have to require for this day. The view towards the network in DNA is that no one network should exceed 50 nodes. So we all know here, like the Wi-Fi password available everyone, and everyone use their own mobile data. So all the time, but there is limited nodes in computer or in computation. The top level network represent the highest level of aggregation here. So DNA controlling system can be done through the University of Zurich, where mapping can find the PCR-free protocol, and label can be done in DNA using the cipher key. So electrochemical sensor can detect heavy ions in the water, and enzyme-based immune-specific sensors such as glucometer are the most successful biosensor in the history of chemical sensor. In DNA, the linear programming, like I show the equation of regression equation or straight line equation, so we can do the task for the size of the problem. Here is the peak wave real number in centimeter. For the sequencing, I am saying 669 sequencing, 671 for the peak wave number artificial. These are basically assumption basis. Artificial means these are assumption basis centimeters sequences. And 899 centimeter, 892, and 1040, there is equivalence in the third group. So absorption optimization can be formed by the wavelet theorem, and we can say it is assigned by W, M, S, 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 and S. So here is our next slide, which belongs to sequence. Like this, you can note it down because if figure is enlarged, can be do by 60 centimeter or whatever else. Here is a picture taken from iStockphoto.com, and these are the sequencing formula here. In equation 3, which I repeat that this is equal to Bn, which is equal to sigma of Cik. Cik is basically the joint matrix of 1, 0 and 0, 1. And we can collect the blood sample both in fresh and the frozen condition format. The conclusion here we get that the recent advance in 3D visualization and the physical based simulation technology at both software and the hardware level, we can develop the game, or can we say that DNA sequencing game, for creating the compiling the visually immense gaming environment for deoxyribonucleic acids. For certain more game is to improve for AI in the zone of the model, and B DNA or control volume model solve the conversation equation of sigma of Cik. So it is assumed that mRNA that in the control volume are uniform at any time, and we can do the MATLAB coding, which will provide, if anyone needed, then I can get. So better DNA mapping in the human management for getting properties of the blood groups. These are the reference, and thank you all for listening.
Any questions, please, from the audience? Can I ask?
Yes.
You use the word calcium channel blocker in first of few slides, antihypertensive drugs.
Where?
What is the involvement of these antihypertensive drugs in your research?
Okay.
I didn't get
Because
the point.
when I ask your blood group, what getting, you get hyper, why you are asking? So this is done in social media by the Facebook page. I created each and everyone asking me why you are asking our blood group. What is the purpose? So it is also a question which gives a hypertension itself. So I like this.
Any other? Thank you. Thank you, Doctor.
Okay, so this session is closed now. Unfortunately, most of our presenters were not present. They were absent, and it was a nice badge of few good presentations concerning the different issues in our medical sciences and biological sciences. So the session is closed now, and we will proceed with the distribution of the the distribution of the certificates for the presentation. Thank you very much.
Thank you all. Now the ceremony of certificate distribution is going to start for oral presentations. For this, I request Dr. Nadia Rahim to please present the certificate to our respected candidates.
Now I am calling the names of oral presenters to come on the stage and receive your certificates one by one. First, I would like to invite Dr. Fakshina Anjam. Please come on the stage and receive your certificate. Now I would like to invite Dr. Maqsood Rahman. Please come on the stage and receive your certificate. Dr. Maqsood Rahman. Okay. So next I would like to invite Dr. Kainat Asmat. Please come on the stage and receive your certificate. Next, I would like to call Dr. Naila Rosie. Please come on the stage and receive your certificate. Thank you so much, Dr. Nazia Rahim and Dr. Shehzad Irfan, for presenting the certificates. Your support and recognition means a lot to all of us. Now I would like to invite Professor Sobia Tabassum. Please come on the stage and represent the certificates to the respected candidates. Now I would like to invite Dr. Nazia Rahim. Please come on the stage and receive your certificate from Professor Sobia. Now I would like to invite Dr. Naveed Sadiq. Please come on the stage and receive your certificate. Now I would like to invite Dr. Shehzad Irfan. Please come on the stage and receive your certificate from Professor Sobia. Now I would like to call the name of Dr. Saima Mahmood Malhi. Please come on the stage and receive your certificate. Now I would like to call Dr. Shaista Kamar. Please come on the stage and receive your certificate. Thank you so much, Dr. Sobia, for presenting the certificate to our respected candidates. Now I would like to call Dr. Maqsoodur Rahman. Please come on the stage and present the certificate to our respected candidates. Dr. Maqsoodur Rahman. Okay, now I would like to call Dr. Shehzad Irfan. Please come again on the stage and represent the certificate to our respected candidates. Dr. Sobia Tabassum, please come on the stage and receive your certificate. Now I would like to call Miss Anusha Tahir. Please come on the stage and receive your certificate. Poster presenter Miss Anusha Tahir. Okay, so now I would like to call Miss Hafiza Aska Mumtaz. Please come on the stage and receive your certificate. Now I would like to call the name of Dr. Miss Resham Munaf. Please come on the stage and receive your certificate. Now I would like to invite Ms. Sundar Sasan. Please come on the stage and receive your certificate. Now please, Ms. Sobia Raza, please come on the stage and receive your certificate. Now in the last, I would like to call the name of Dr. Maqsood Rahman. Please come on the stage and receive your certificate from Professor Shehzad. Thank you, Dr. Shehzad Irfan, for handing out the certificates. Your contribution is valued and deeply appreciated. Now please wait for the group photo.
Am I audible? We have just 5 to 10 minutes. Meanwhile, the room 4, they will be free from certificate distribution and we will proceed towards the closing ceremony. And for that, I would like to request Professor Dr. Rubina Hanif to join us on stage so that we can prepare for the closing ceremony accordingly. During this time, if any of the attendees have any question related to ACSE or Emerging Scientists Conference, please feel free to ask. As I see, there are many faces that already are very much familiar with Asian Council of Science Editor, but still there are new faces who are new to this platform and heard the organization's name very first time. So this is the official website of Asian Council of Science Editors, and I would like to let you engage for a few minutes. Meanwhile, the second room will be free from certificate distribution. Asian Council of Science Editors is a non-profit organization based in Dubai, and the major aim that we call for ACSE is bridging the gap between Asia and the rest of the publishing world. I would say that the role of ACSE starts when our early career researchers plans to write for the paper, research paper, and moving forward to the struggle of publishing, and then afterwards the struggle from publishing to visibility, then indexing, and then regional barriers and problems that the editors face, that the authors face, the reviewers face. So the ACSE platform is mainly for the publishing sector. I would say it involves the research community as well, including authors, reviewers, editors, publishing sectors, librarians. Our core values that we prospers, it's networking, it's among researchers and the publishing world too, it amongst the community of research authors, researchers and authors, that we connect them with editors, with publishers, with new tools that facilitates publishing experience for journal administrators. We strive for collaboration between industry and academia. We also train through our capacity building program at national and international level, and Emerging Scientists Conference is one of the programs that is the capacity building program by ACSE to develop some skills, awareness among researchers, early career researchers, and expert scientists and researchers from Pakistan. Lastly, we engage ourselves in dissemination. That is overall, I would say, again, a part of awareness that as in the last 2 to 3 years after the COVID, we have been shifted to digital age. So there is a need that every researcher, every editor, reviewer, they must know what sort of tools have been created and how they can be used and how they can access, especially considering budget issues in Asia. Allow me to introduce the Board of Directors of Asian Council of Science Editors. It operates through 6 to 7 members, including First President, Vice President, Secretary and Treasurer, and Directors. It's about 4 to 6 directors, and currently we are a cabinet of 8 members who are striving to put their efforts in compiling some real-time issues and challenges of Asian publishing community. Another segment of ACSE is its advisory cabinet, as we need advisors for regional cases, just like I have been in discussion today about journals and what sort of problems today's researcher of Pakistan is facing. Either it's through ACSE, through their policies and their institution. So the advisory cabinet basically of ACSE, they put their effort in analyzing such sort of cases and provide some strategic decisions and SOPs on how they can facilitate the process, maintaining and following their general, or you can say the national SOPs too. The advisory cabinet, it includes about 8 persons again that are from different geographical backgrounds with different expertise. Lastly, I would like to share the industry solutions that are built till now by ACSE to facilitate Asian publishing community is Index One. This is only member-based database that indexes the content that is qualitative in terms, and there is a huge production that is being published every year from Asia, but still not coverable. So Index One is the tool that indexes all of the content that is qualitative. Secondly, it's Journalspedia. Just like a number of candidates would ask that if we are going to present or join some conference, either it's predatory or not. Same issue the researchers, the authors face when they publish their paper, that either the journal is reputable or not. So Journalspedia is a tool that will allow you to identify or distinguish between the reputable and non-reputable or predatory journals. The last one is Science One. It's an online submission system that is developed and designed to dedicate the scholarly publishing ecosystem, especially the journal management system. The Science One tool, what it do, it will help the journal management teams in processing their online submissions. The institutes that are processing some journals, they are publishing their journal from their institutes. They can review this tool to manage the submission and review process. It is fast, efficient, and I would say this is the first ever online submission system that is customizable. This is a basic copy that you can customize it on your own, and one of the examples recently, Dr. Rubina Hanif, their institute, NIP, is running a journal, Pakistan Journal of Psychological Research, PJPR, and they are using Science One. So in the closing remarks, I would like to request Dr. Rubina to please share their feedback with us too. Now that our cameraman is back, we will start with the rest of the certificates. And for that, I would like to request Professor Dr. Muhammad Sarwar to join us on stage. He is Secretary and Treasurer of Asian Council of Science Editors, and I would say the main backbone of ACSE. Now, first we will follow the certificates of session chair. I would like to call upon Professor Dr. Sobia Tabassum to please join us on stage. The next candidate in queue is Dr. Shehzad Irfan. The next candidate in queue, Dr. Najia Rahim. The next session chair, Professor Dr. Farkhanda Manzoor. I would just like to know if Professor Kashif Ali is here. Professor Dr. Rubina Hanif. The next session chair, Mr. Giyas Akram. Now I would like to call upon Professor Dr. Amir Saeed. The next session chair, Dr. Iza Anwar. The next session chair, Dr. Manzar Zahra. Let me know if Dr. Mushtaba Ilahi is here with us. Now we will proceed with the certificates of poster evaluation committee members. The very first name for poster evaluation committee member for the conference track medical and health sciences, Dr. Najia Rahim. The second certificate is for Dr. Maqsoodur Rahman. Now I would like to call upon Dr. Abdul Nawi Judge as poster evaluation committee member for conference track agriculture and biological sciences. And next evaluation committee member for the same conference track agriculture and biological sciences, Dr. Farkhanda Manzoor. Moving to the next conference track, Social Sciences and Humanities, I would like to welcome Dr. Rubina Wasim to please join us on stage. The next candidate for Social Sciences and Humanities is Dr. Shahid Minhas. Moving towards our last track for poster evaluation, it's Physical Sciences and Engineering, and I would like to request Dr. Iza Anwar to join us. Again, I would like to request Professor Dr. Amir Saeed to join us on stage and receive his poster evaluation committee certificate. Now, I would like to express special thanks to Asian Digital Library for providing us local support, and would like to call upon Ms. Farzeen Amara, the local organizing committee member from Asian Digital Library. Now, here we are going to move towards our last segment, the most awaited one, the poster winners. For the first conference track, Medical and Health Sciences, and the winner of this, it's Dr. Sobia Razak from University of Management and Technology, Lahore. The second track, it's Agriculture and Biological Sciences, and the award goes to Dr. Hafiz Muhammad Tahir. You can check the envelopes too with the cash prize. The third conference track, it's Social Sciences and Humanities, and the Best Poster Presentation Award goes to Miss Aruj Rashid. Now the last track, it's Physical Sciences and Engineering, and the Best Poster Presentation Award goes to Mughal Sharif from Bahia University, Karachi. Now moving towards our last segment of conference, I would like to request Professor Dr. Rubina Hanif to join us for closing remarks. Please give a big round of applause for her.
Bismillahirrahmanirrahim. Thank you very much, Mariam Sahib, for giving me this opportunity to say thanks to the organizing committee and as well to the audience. I think like my topic, again these remarks have dual impact. I am part of organizing committee and at the same time as participant of this organizer. So I am really very thankful for organizing this commendable conference. All the event went very smooth, and the quality of papers presented, actually this was the main thing which has made this day successful. So I would like all the participants, please give a big applause to all the participants of conference. Asian Council for Science Editors. It's a big name. I am working with them from years. Initially, I joined their conference first time in UAE, and that was marvelous experience. And then consecutive 4 conferences, I guess, I attended. And the Emerging Scientist Conference, this is really a good initiative for early career scientists and especially for students. So you can see the participation of students and their excitement, and especially congratulations to all those who presented paper and posters and those who have received cash awards as well. When you present your work in an audience like this, either this time the number of participants are less from last 2 conferences, but I think quality matters than quantity. So all the papers presented in my session and other sessions, all papers were excellent papers. And this interdisciplinary experience of listening researches for students, I think you seldom get such kind of opportunity and this is actually good for you because in this era we are moving toward interdisciplinary approaches in research. So you should get out of your box, you should see what other disciplines are doing. They can help you to improve your work and to develop networkings and contributions in other disciplines as well. As Mariam told that Asian Council for Science Editors has many chapters and every chapter is doing wonderful job. Recently we get collaborations from this forum for our journal, Pakistan Journal of Psychological Research. This journal is being published from years, I think from 1986. It has good repute in social science journals, but the increase of citation within last 1.5 years from the day we joined this Sci1 system, this is excellent. I think we would be able to tell you exact statistics in next conference. And I will request Mariam, please, you should share the statistics with audience so that people can know the improvement of journal citations, because this is what every researcher want to get the recognition. So from the day we are on this system, we are running very smoothly. We get quick response from reviewer as well. So all the people who are running journal, I will recommend rather that Sci1 is very good system. You should discuss with Mr. Server that how you can get it. And then Asian Digital Library. This is also very good forum. So you should explore what is Asian Council for Science Editors can do for us and how we can get benefit from them. So once again, I am very much thankful to all the organizing committee, your hospitality, love and networking you provided us, and I am sure next time I would like to see all of you in Dubai conference and then again in Faisalabad. So next time you should make it 3 days conference. Thank you very much.
I would like to request all of the attendees and participants to please join us in lobby area for group photo.